Aortic aneurysm is a focal dilation of the aorta, with the enlargement representing at least 50% increase over the normal aortic diameter. Aortic aneurysm is the result of chronic degeneration of the arterial wall, particularly the tunica media. Smoking, genetic, male, and older age are risk factors for this condition. Currently, it's recommended that men who are between 65 to 75 years old who have ever smoked should be screened for this condition via an ultrasound method. One thing we would like to make clear, aortic aneurysm is not the same condition as aortic dissection. Aortic dissection occurs when the lining of aorta ruptures and allows blood to leak outside of the aorta. This condition can quickly lead to dying. We don't want that to happen. The problem is aortic aneurysm can lead to aortic dissection. Aortic aneurysm, when patients have this condition, usually they are asymptomatic. This is why screening high-risk population for this condition is important.
The research we'll be discussing in this presentation is a 2013 study published in the International Journal of Cardiology. The title of this study is Mechanisms of Oxidative Stress in Human Aortic Aneurysms, Association with Clinical Risk Factors for Atherosclerosis and Disease Severity. So this study examined the role of oxidative stress in the pathogenesis of aortic aneurysm. Both tissue and blood samples of patients with abdominal aortic aneurysm were obtained during aneurysm repair surgery and were then analyzed using a number of validated tests. In the blood, researchers found that malondialdehyde, which is an oxidative stress measure, was 2 times higher in those with aortic aneurysms than with counterparts with non-aortic aneurysm coronary artery disease that had been matched to ensure a similar risk profile. In the tissue, superoxide concentration in aneurysm tissue was greater than in samples taken from separate aortic locations of the same patient. Researchers noted that the highest superoxide content was associated with patients that had a history of smoking, hypercholesterolemia, and an existing coronary artery disease. So these results really indicate that there is a relationship between the development of vascular superoxide production and an associated risk of developing aortic aneurysm. Now that we understand the study details, it's important for us to ask, what is the clinical relevance of these research outcomes, and what does it mean for us as healthcare providers? We know that aortic aneurysm is a potentially life-threatening condition, and it represents an important source of cardiovascular mortality. Understanding the inciting factors for this condition is helpful for us to direct our treatment, but perhaps more importantly for us in the naturopathic community is that it can guide our prevention strategies. Lifestyle modifications can potentially make a big difference here. We saw from the research that the 2 factors that were most highly associated with an increased risk of aortic aneurysm were a history of smoking and hypercholesterolemia. So this is a great opportunity for us to use our tools for establishing the foundations of health counseling, diet, exercise recommendations, and really addressing our philosophy of prevention of disease. We also know that naturopaths are great at managing inflammation, and since inflammation is part of the etiology, the pathogenesis of aortic aneurysm, this is an important aspect of treatment.